naturopathic doctor, and I'm here with my colleague, Dr. Daniela Jesin. This is another episode of Vital Moments. Tonight, our theme is going to be sleep. And the reason that this is a very timely topic is that, with COVID-19, it's really important for us to keep our immune system strong. And there's no way that we can have a strong immunity without getting adequate sleep. And I think it's fair to say that, as a population, a good percentage of Canadian adults are not getting enough sleep. Studies show that we should be getting at least 7 or more hours of sleep. And even though I tell my patients that they should be doing that, I'm just as guilty as some of you out there that are not getting enough sleep. And I know there are people that suffer from insomnia, where they have difficulty falling asleep or staying asleep, but there's a good number of us that are suffering from sleep deprivation because of what I call voluntary deprivation, right? That means we're doing things in the evening, whether it's, catching up with Facebook or watching Netflix or doing our emails, and we're just staying up way, way, way too late. So tonight, I want to talk about why it's so important to get enough quality sleep. And then my colleague, Dr. Jesin, is going to give you some ideas of how to improve your quality of sleep. So first of all, I think it's fair to say that every system of the body is affected by quality and quantity of sleep. In 2013, there's a study done in England, and what the researchers found is that after a week of sleep deprivation, over 711 genes in the body are affected by not getting enough sleep. And some of these genes are involved with immunity, inflammation, stress response, metabolism. So in other words, really, really important functions. So for those of you that are not getting enough sleep out of choice, I want to give you some compelling reasons why it's really important to get enough sleep. One of the most important organs and systems that's affected by sleep deprivation is the brain. Now, all of us want to age and be able to keep our marbles and not get dementia and Alzheimer's. Well, the brain, hormones are produced, through the day. And one of the hormones that affects energy is cortisol. So in our sleep is when the body breaks down cortisol. So if you're getting a good quantity of sleep, your body is able to break down the cortisol and reduce it to a nice healthy level. But in the night, if you're not getting enough sleep and your cortisol levels are allowed to stay high, well, the next morning between 5 and 8 a.m., your adrenals are pumping out more cortisol. So in the presence of high cortisol, it can affect the immune system, it can affect inflammation, it can affect blood sugar, it can affect cholesterol. So that's just one hormone, right? The other hormone that's affected by not getting enough sleep is melatonin. Now, melatonin is produced by the pineal gland, and it sets the circadian rhythm, or the sleep cycle rather. And so as the day gets darker, your pineal gland is producing melatonin to get you ready for sleep. But if we're not getting enough sleep and we're not producing enough melatonin, that can have a dramatic effect on our immune function. In fact, studies show that people that are not getting enough sleep, their immune systems are poorer. So in these days with COVID-19, that's the last thing you want, is to have a poor immunity. So other things that can be affected, cardiovascular health, right? Rhythm problems, even heart attacks, you're much greater risk for when you're not getting enough sleep. Weight gain and obesity, right? Not getting enough sleep actually affects impulsivity. It affects your food choices. It affects metabolism. So these things will affect your weight. For those men out there that are thinking, it's not going to affect me, I'm not worried about blood sugar, I'm not worried about cholesterol. Well, what about libido? What about sexual function? Lack of sleep affects those things as well. So the blood sugar, we know that diabetes is on the rise. In the night, when you're sleeping properly and getting enough sleep, the body breaks down blood sugar. If you're not getting enough sleep, insulin resistance, pre-diabetes, diabetes can come from that. So it's so important to get enough sleep. And when it comes to brain function, excuse me, in the night is when the brain cleanses and detoxifies. There's a system in the brain called the lymphatics. So it's a combination of two words, glial, which means brain cells, and lymphatics, means the lymphatic system, which is responsible for removing toxins at a cellular level. In the night when we're sleeping, the brain actually shrinks and it's almost like it wrings toxins out. And so if we're not getting enough sleep, those toxins can build in the cells of the brain and create a toxic environment, which is not very good for the brain. So all in all, there are so many reasons why that we need to get a good quality sleep. And some people say, well, I only need 6 hours sleep, or I only need 5 hours sleep. How you tell whether you're getting enough sleep is how are you functioning during the day? If you're able to, stay wide awake and get things done and not feel yourself, nodding off, during the day, if you're at a light and you're feeling yourself nodding off, or you're reading a book and you're reading the same line over and over, or you're nodding off, you're not getting enough sleep. Don't fool yourself into thinking that just because you're able to function and get through the day, that you're getting enough, right? Studies show that we need at least 7 or more hours of sleep. So aim for that and create better habits. And now I'm going to turn it over to my colleague, Dr. Jesin, and she's going to talk about the concept of sleep hygiene. Dr. Jesin.
Thanks so much, Dr. Yim. Hi, everyone. Thanks for tuning into this week's episode. As Dr. Yim was saying, sleep is so important. It's always so important. And especially now with everything going on and the last couple of weeks, a lot of our routines and schedules have been drastically shifted and changed. A lot of us are potentially even going to sleep later than we usually do, waking up earlier than we usually do. We are having to navigate different schedules with our children and with our work, and this can really wreak havoc on our circadian rhythm, which Dr. Yim just spoke about. So that's our sleep-wake cycle that helps to keep things really regular and healthy and help with the functioning of all of those really, really important systems that we just spoke about. And so the two really important hormones that really help to balance the sleep-wake system is our melatonin production, which is produced at nighttime, and it's produced when it gets dark at night. And then our cortisol, which is higher in the morning, which gives us that little bit of jolt of energy to be able to respond and have resilience to respond to the stressors of our day. And so when this balance is disrupted, just from having a disruptive cycle, we can be left feeling really fatigued. We can be left feeling more anxious, more stressed. We can have even more difficulty falling asleep, staying asleep, all of those things that can really, really affect our quality of life. And so now more than ever, people are having myself included, are having a really, really hard time regulating this. And so what do we do about it? What can we do to help our sleep cycle, to help our hormone production, and help to optimize our health during this time? And so it's easier said than done. I along with Dr. Yim, I also like to stay up late and watch Netflix and do all that fun stuff at night. And I can attest, I've been there. It can be really, really hard to change our habits. And so I just want to talk a little bit about some really simple lifestyle things that we can do today to help regulate that cycle and our hormonal production so that we can just feel as good as possible. And so sleep hygiene essentially is what you do in the hours leading up to going to bed. And we call it hygiene because we try to just minimize any sort of obstacles or things that may get in the way of allowing our body to really fall into that nice restorative sleep and allow that melatonin production to be produced. So as Dr. Yim spoke about, melatonin is that hormone, and it's produced at nighttime from our pineal gland and in our brain, and it's stimulated by darkness. And so what happens, especially with all of us watching Netflix, is that the light from screens, the light from the TV or from your phone or from your tablet, it can send signals to your brain and stop that production of melatonin, which is that really important hormone that allows us to drift into that nice sleep. And so part of sleep hygiene is to stop looking at any screens for, ideally 2 hours before bedtime. And you might say, oh, no, I can't do that. I don't want to do that. That's too hard. I like to, watch my TV before bed. And so, even if that's really difficult for you, which I can empathize with, there are ways that we can still minimize this light. So you can get something called blue light blockers, which are really fantastic glasses that you can wear a couple hours before bed, so that if you still are having some screen time, it can minimize that light production from those devices. But ideally, you would start, you would read a book or something that just allows you to allow that nice melatonin production to be produced in your brain. Another part of sleep hygiene is what we use our bedrooms for. So a lot of us may have trouble falling asleep because we have, thoughts in our minds, some stress keeping us up at night. And there's a lot of studies showing that if we use our bedrooms for things other than sleep, such as doing work in our room, and I know that that might be really relevant for people right now who are working from home and potentially bringing their stress from work into their bedroom. You can actually associate, without even realizing it, a subconscious association between that stress that you were doing in that room and then, affecting how your mind can calm down before bed. So I always recommend, if possible, if you do have a second room, to try to do anything that doesn't relate to sleep or relaxation outside of the bedroom, so that when you come into your room at night, it's a cue to your mind, okay, it's time, we can calm down a little bit, we can relax. This is the room to do that in. And so I always tell people, it seems like something simple, but it can really, really make a big effect and a big impact on people's stress levels at nighttime. Another thing that is really a really easy thing to help with initiating sleep is that a lot of people have food cravings at night, and that's very common. And I know there's a lot of potential urges to snack and have sugary foods at night. And there is, unfortunately, a big connection with eating foods that are high in carbohydrates or high in sugar, with affecting blood sugar and insulin levels throughout the night. And what happens if you eat, a chocolate bar or even a sandwich that has, not such healthy carbohydrates in it, is that our blood sugars will spike in the middle of the night, and it can actually cause you to have not such a good sleep and not get into REM, your REM deep sleep. And so what I'd say, if you can avoid eating before bed, that's the best. But if you're someone who needs to eat something before bed, or if you have a health condition that, you need to eat something, try to eat something that is higher in protein or higher in fat and lower in carbohydrates, so that you don't get that sugar spike in the middle of the night that might keep you up. Other things to think about is, of course, caffeine. We all know it. I'm personally a coffee lover, so I understand the struggle, but caffeine affects everyone differently. And so if we can try to stop drinking caffeine, by early afternoon, it's really a good idea to help with sleep. I know most people know this, but it's always a good reminder. I love drinking warm drinks, and it gives me a lot of comfort. So on last week's episode, which we hope to share with you soon, I showed just different herbal teas that you can substitute in for that coffee later in the day. Things like lavender, chamomile are really nice herbs that can be really relaxing and nourishing for our parasympathetic nervous system and help us to get into that relaxed state and not keep us caffeinated. Other things that are helpful for people who like the texture and taste of coffee, you can have, a dandelion coffee blend. There's mushroom coffee that doesn't have caffeine in it. That's delicious. There's lots of suggestions and substitutions if you just love that creamy texture, which I personally do as well. So just doesn't have to be all or nothing. You can sort of sub in other things that can give you that same satisfaction that can be really, really nourishing for our adrenal glands. Another thing I'll say, exercise is so great for all of us. We should all be doing exercise when we can. For a lot of us, though, if we do vigorous exercise within 2 to 3 hours of bedtime, it can just pump out a lot of that adrenaline and endorphins and sort of disrupt our ability to fall asleep. So try to exercise a couple hours away before bedtime. And the last thing I'll say is that it's great to just have a little bit of a routine if possible, whether that's doing a little bit of a meditation, drinking a little bit of herbal tea. Maybe you're someone who wants to relax with an Epsom salt bath. Having just that time to do that one thing that signals to yourself that it's time for bed can just get that body into that nice parasympathetic restful state so that it's easier to fall asleep. Those are some of just some really, really great lifestyle tips that you can start right away. And if anyone's looking for more support with their circadian rhythm, their stress levels, and just they're having trouble with falling asleep or staying asleep, definitely speak to one of the naturopaths at VitaCare. We have lots of other suggestions through nutraceuticals and herbal supplements that can be really, really effective as well if we just need a little bit more support in regulating our hormones and our circadian rhythm. So I hope that was helpful, and I will pass it back to Dr. Yim.
Thanks, Dr. Jesin. Just out of curiosity, this is a little bit of trivia. I read not that long ago that the half-life of caffeine in the system is 8 hours. So if you have a coffee at noon, that means at 8 o'clock at night, 50% of that caffeine is still in your system. So depending on your sensitivity to caffeine, it may not bother you at all having that much caffeine in your system. But for somebody who is caffeine sensitive, that might be just way too much caffeine. And they may say, well, I haven't had coffee recently. I haven't had coffee since lunch. But they may not realize that half the caffeine that they had at lunch is still circulating at 8 o'clock at night. And so if they go to bed at 10, there may still be quite a bit of caffeine in the system, even though by 8 o'clock it's down to 50%. So it's something to think about, right? So part of it has to do with how well our livers clear it. But the second thing is, how sensitive are you to caffeine? So for people that aren't sensitive, I know people that swear that they could have coffee just before bed and still fall asleep with no problem. So obviously that person is not that sensitive to caffeine at all. But for those of us that are, even a green tea, something that has less caffeine, might be way too much. So it's definitely something to think about. So I hope you enjoyed this episode of Vital Moments, and join us next week where we will have another topic to educate and entertain you. So good night, and join us again next week.